Right now, I'm joined in studio by our two guests, that is two professors. That is Professor Alois Orago, who is a professor and a researcher in clinical immunology and epidemiology of infectious diseases. He has been the head of Kenya National AIDS Council and right now is based in the Department of Pathology School of Medicine in Kenyatta University. Also with us tonight, Dr. James Ogutu, who is a microbiologist. He's a lecturer of medical microbiology and molecular diagnostics. Until January this year, he had been heading the Department of Pathology in the School of Medicine in Kenyatta University. He's also a researcher in pathogenesis of opportunistic infections. Clearly, you can see that I'm having powerful guests tonight. You don't want to miss this particular discussion. Many thanks for choosing to join us. I'm honored to have you with us.
Thank you for having us.
All right, let me start with the Professor James Ogutu, that is the microbiologist on my far right. Professor, what's now the global outlook of coronavirus as we speak?
Well, thank you for the opportunity once again. I would like to say that the global outlook of coronavirus that started in December 2019 in Wuhan in China.
Yes.
Where the epicenter was there for quite some time. The epicenter has now moved to Europe. I would like to say that the pandemic right now, it has been declared a pandemic by the World Health Organization, and the epicenter has moved to Europe, where Italy is actually seriously affected. We have a lot of cases that have been identified and confirmed in Italy, and the rest of the other countries, there is also, Iran is also badly affected, and the other countries in Europe include France, Germany. The US is also being affected, yes.
And right now, let me get back to Professor Alois Orago. Someone asked me earlier on about the type of food that someone maybe needs to consume so as to boost their immunity to help them fight this particular virus.
Right. The food items that one would need to ensure that the immune system remains intact would actually include a big number of them, starting with proteins, necessarily proteins that are coming from plants.
Yes.
We also need a lot of vitamins and we need minerals. Specifically, we would need zinc. We'd also need iron because those are very important in the functioning of cells.
So what are
of
some
the
of the
immune
food
system.
that really contains zinc and iron?
Eggs, you would have it from fish. You'd also get this from green vegetables, specifically the traditional ones, what we call managu and chisaga. That's one of the languages that is common. Yes, and murenda.
Okay.
Yes.
All right. Now, what's your take on the speculations about coronavirus having originated from bats and snakes?
We know that these are viruses.
Given that, having in mind that the Chinese actually feed on those particular animals.
We know that these are viruses that are found largely in mammals and some lower primates, but not humans. And there has been evidence that the viruses undergo mutation, and that would really be a change in some of the amino acids that are found within the core protein, the core of the virus itself. And that when these mutations occur, the arrangement is changed, and that increases the virulence of these organisms so that they can spill over from their original hosts to new hosts. And that is what I think is happening. Yeah.
So, Professor, do you think it really originated from snakes and bats?
Well, it is important to note that coronaviruses are zoonotic viruses. Zoonotic viruses are viruses that can infect both humans as well as animals. Now, if you talk of China, Wuhan, Hubei province, where it originated, it is very much possible that the virus could have originated from birds. It has been documented that coronaviruses, including the SARS virus 1, which had an epidemic in 2002, 2003, and the Middle East respiratory syndrome virus, whereas the SARS virus is believed to have originated from a bat, the Middle Eastern respiratory syndrome coronavirus is believed to have originated from a camel to humans. So it is very much possible, because of the close contact that some of the traders, you know, the story has it that it was in a seafood market, and they were selling also wild meat, including the birds, in that place. So there is a possibility it could have originated from birds.
Okay. Okay. And in terms of immunity, a lot of people have been asking why the disease only, or rather, most of the patients, most of the victims of this particular disease are elderly people in terms of immunity. What can you say about it?
What really compromises the immune system include comorbidities. These are people, maybe because of age, they have pre-existing conditions like diabetes, they could have hypertension, they could also have other autoimmune diseases, and this would therefore make the immune system more vulnerable to attack by foreign bodies, including these spillover viruses.
So in case one is infected, what's the very first step that somebody should really take?
Well, if somebody is infected or is suspected to be infected, we necessarily take the medical history. Where are they coming from? Have they traveled to a country where there are people infected? Have they developed symptoms? Specifically, do they have fever, which can now very easily be monitored using a smart CCTV that has been developed by a team from the University of Northumbria in Newcastle, UK. And we also have thermometers now that are used to detect fever. And if they have a dry cough...
Do we have them in Kenya right now?
We have a few, but you'll find them in most airports. I know there's I saw a huge order of thermometers that were made to come from Dubai and China. And China itself, with the lockdown, their factories are not working. So there's actually an acute shortage of those thermometers. But there are some that are actually getting into the country from Turkey. Yeah.
So what if they don't get to the country? What's the way forward?
Life will go on, because I think we have enough for the counties, but we may not have enough for all the health facilities. But I think in about a week or so, we should have new orders that would probably go into new health facilities that require them. So
do you agree with the government that the counties, the 35 counties, are well equipped to handle this particular virus? Do you agree with the government on the same?
I think if it comes from the government, it must have some truth in it. But you know, when you're talking about equipment in labs, you may have skeleton equipment, but the level of sophistication the required in labs would actually require more advanced diagnostic kits coming from elsewhere to join in the skeleton that probably is in the 35 counties. But I think, yes, there's a very high level of preparedness.
And still on your line of study, that is immunology, as the nurses getting their training starting tomorrow, that is on Tuesday, according to the government, what are some of the procedures that the nurses should be taken through in terms of training people or advising people on immunity?
I think how to protect themselves will be key. They also need a level of mental preparedness, in fact counseling, so that they know that they are working in a high-risk area and that they have also to be prepared to be able to protect their families when they get back there, and that this is not a death sentence, that is manageable, and life should go on. So we should just roll out training, those who have been trained to train others, so that there is we have a big number of nurses who are actually the first line of contact with patients.
Right, so Dr. Ogutu, do you think that the government took too long to cancel the flights to Kenya?
Well,
given that, we remember this case actually, way back in December 31st, that is when Chinese reported to the World Health Organization about a certain kind of pneumonia. Actually, it was the coronavirus. Now, did you take too long? Remember, Taiwan also cancelled theirs in early January. So do you think Kenyans really took too long, or they were in order so as to prepare themselves?
Thank you, Lydia. The country has systems. A few days ago, I was here, and I said that the government has a mechanism and a capacity to monitor the situation. And whenever the situation becomes dire, then they will give updates on the same. So I believe probably that the government was still monitoring the situation. And after they monitored the situation and it was time to cancel, they did. I know what comes from the public may sometimes be some kind of mistrust between the public and the government.
Yes.
But I should think that everybody should be able to put their trust and believe the government in the updates that they give and in the measures that they take.
And what do you make of the situation where some citizens are thinking that that time that government allowed the flies into the country, it enabled the virus to get into the country? They're now placing blame on the government. What's your take?
I think whichever way, there was always some possibility of it spreading to Africa, Kenya included. So that may have been caused by some level of panic, some level of fear, and of course, when there is panic and when there is fear, there is always impatience on the side of the citizen. Probably what the government ought to have done is they would have started updating the populace well on time, so that they knew what the government was doing all along, so that that fear would be actually circumvented from the beginning. Yes.
Just before I go to Professor, take us through the sanitizers. Which is which? Is it the soap with water or sanitizers? Because some people argue that if it is sanitizer, it must have 60% alcoholic content. What's your take on it? Is it soap with water or sanitizers? Which is which?
Well, for the common mwananchi, what they need to know is that washing hands with soap and clean water is good enough.
Okay.
And that can be as frequently and as regularly as possible, because exposure can take place at any time, even through contact with inanimate objects like surfaces, door handles, and so on and so forth.
Yes.
So washing with soap and water is enough. All someone needs to know is that they should not leave out some parts of the hand, because there are specific areas of the hand that normally are left when people are washing hands. So when they take care to wash all parts of hand with soap and water, that is adequate. However, it is also sometimes, under certain occasions, you may not have soap and water. For instance, maybe you are traveling, maybe you are in the office or somewhere where there is no water. You can also use alcohol-based sanitizers. And WHO says that the alcohol percentage must be above 60%. Although we know even before COVID-19 came into being that sanitizers are always used. And of course, we know most of the ones that we use, especially in our labs, have an alcohol content which is slightly higher, around 70 to 75%. But WHO says that from 60% alcohol content, it is still effective.
Okay.
Yes.
All right. One of our viewers, Josephat Koech, asks about the period of time that the virus can stay alive. Can you just give an insight on that?
Depending on where it is, there are reports that it can stay for up to 10 days in some cases.
10 days?
Yes, depending on where it is. because being largely droplet transmitted, it depends on the thickness of the droplet that we're talking about and where it lands. It may land on the surface which is heated, then it will perhaps spend the least time alive being obligate parasites.
Least in this case means how long?
We are talking about up to about between 10 and 28 minutes. In fact, some reports indicate
minutes.
Up to minutes.
Okay.
Yeah. But if it is in a very moist place, it can stay for up to a week or 10 days.
What's your take on that, sir? Just chip in.
Well, I would want to agree with Professor.
Okay.
Basically, this will depend on the environmental conditions. Because if it lands on a wet surface, if it lands on the glass, it's different from how it will respond compared to when it lands on wooden surface. But I think what we need to underline is that there is need to avoid complacency. Because probably the reason why the gentleman has asked that question, Mr. Koech, is probably because they think that if I come into contact with it, probably with my hands, then I will need to count 30 minutes, then it would have died or it would have been eliminated.
Okay.
Now that would bring in some level of complacency. All we need to know is that our good hygiene practices should be up to date, and that will help us.
Let me take us back again to our social media platform. Emmanuel Ngetich Ndiema also asks about, he hears that most patients are taken to ICU when they have coronavirus. He's asking about the extent of this particular infection. How far does it go?
Well, thank you for the question. I would want the listener and the viewer to know that it is the contrary. Most of the patients don't end up in the ICU. Actually, in 80 to 90% of the cases, the infection is mild and may sometimes not need any
So does
serious
that brings us
medical
back to
attention.
immunity, right?
That would bring us back to the body's natural immunity.
Okay.
So if you are immunocompetent and you are an active person
Yes.
without underlying diseases.
Active in this case means what?
Active in this case means you are active, you are exercising and all these kind of things. So in such individuals, and the age is not past 60 years, these kind of people normally, they may just suffer a mild bout of the infection. However, in a small percentage, normally they will have serious condition that needs to be managed. As yet, as we have said before, there is no treatment for COVID-19. And also, there is no vaccine for COVID-19. So when they end up in the hospital and it is a serious case, then we are managing the complications that the patient has. Would manage the fever, would manage the respiratory problems that the patient has. We would manage the symptoms. We actually manage or give supportive therapy for the symptoms. This would then give the body ample time to mount up an immune response to clear the virus.
So you're saying once someone is infected, that is it. There is no way back. It can't be treated as we speak.
I'm not saying there is no way back, because the person, the outcome can be the person gets healed. Are you getting me right? Because as we have known, only a very limited proportion of those who are sick normally die.
Is it the same explanation as to why the WHO are saying that some of the patient, you can be infected, but you don't even have some symptoms?
That's exactly what we are trying to say,
right.
that some people will suffer a very mild bout. Mild simply means that it is not a serious disease. Your body is not overwhelmed and there are no complications. So in such a case, then the person may not need serious medical attention. And I need to underline this, that majority of the cases are that way.
So it is quite important that everyone takes care of themselves in terms of what to eat, how you exercise, etc.
Yes, it is important even for those who are infected, apart from the self-isolation or self-quarantine, it will also be important for that person to actually manage their health. For instance, if currently you are suffering from diabetes,
Yes.
just because you are infected by COVID-19 does not mean you stop taking your your diabetes drugs. You
Just
continue with your diabetes drugs as you manage. You would want to eat healthy to boost your immunity. You would want to do physical exercise. You would want to avoid anything that would bring anxiety. You would want to do exercises. Maybe as you are self-isolated, you may want to read books or write or cook, whatever you would want to do. Yes.
So someone might just be asking, what's the importance of self-quarantine? Because right now the government might just, of course, has already ordered people to stay at home. So what's the importance of staying at home? Let them just understand reasons why they really have to stay at home.
Now, self-quarantine in this case is not just isolation. It is social distancing. You want not to come into contact with the rest of the other people because you are a health risk. You are carrying the virus, and you want to limit your contact with the general public so that the chance of you transmitting the infection to them is reduced, limited, or zero. So you would be in a room on your own. If you live with your family, it would be good for you to be in a room of your own where you actually will be staying to exclude the rest of the other people. If they were to use the bathroom and so on and so forth, then you would be the last to use the bathroom in the day. And apart from that, you would also ensure that you don't share things like towels and so on and so forth. So
And
that
the spoons.
And the spoons, and those are called inanimate objects there that can transmit the infection. So during the time for self-isolation, that is the main intention, to avoid coming into contact with the rest of the other people so that they are not infected. It would do you a lot of good during that time also to wear masks. You know, they are talking of masks, and people are going to the supermarkets and the pharmacies to buy a mask. It may not be for the person that is healthy, but for the person who is suspecting to be infected or has been confirmed to be infected, they would wear the mask.
So you're saying if one has not been infected, there is no need for the mask?
Precisely.
Yeah.
All right. Okay. Now,
I would just add something on what James has said. Reports indicate that those who have been infected, 81% of them actually don't need to go to hospital.
really?
Only 14% go to hospital.
Why?
5% because they require the management of those symptoms.
Oh,
requires
okay.
some admission. Only 5% end up in ICU. And even out of those 5% who go to ICU, the fatality rate is just between 2 and 5%.
So it's not a death sentence.
No.
People should
You go
not
to
fear.
ICU and it's not necessary that you will still die out of the condition.
So as we were just talking before this particular discussion, you talked about traveling for research purposes.
Yes.
As a researcher, do you think that there'll come a time when we'll get a cure for such diseases?
The sky is actually the beginning. There's no limit in research, and I think it's just a matter of time. The 30 days that we are in some kind of lockdown is important, because within those 30 days, we will see very clear indications of what route to take.
How long does it take a researcher to get some treatment or vaccine for such diseases?
Vaccine would be different. Treatment, there are many drugs being tried now, drugs for known conditions that exist. And there are indications that some of them are resolving the symptoms. But as yet, we don't have a specific drug for COVID-19.
But usually, how long does it take for a cure or a vaccine to be gotten by the
The
researchers?
vaccine would take a little longer. Like now, if we were...
Is it 1 year, 6 months, 3 months? Or
This is 2020, we would expect a vaccine next year.
next year?
Yeah, because we will perhaps, out of compassion, shorten the time through which we undergo we take this through trials. We would need to only look for, ensure that whatever we have is safe and that it is efficacious.
So
and leave out the other two steps.
So you're saying for us to get a vaccine or a cure, we need to wait for 1 year?
At least 1 year.
Do you think this?
Well, you know, the processes through which vaccines are normally developed is a long, tedious process that always makes sure that the product is safe for use and is also efficient and effective. Now, normally that goes through phase 1, phase 2, and phase 3. So I also believe that probably we could be looking at a vaccine in a year's time. Yes.
All right. So
Yes.
1 year.
Yes, nearly
Okay.
1 year.
But
Yeah.
clearly it's not a death sentence, so people should just remain calm and observe the basic requirements.
That's for sure. We should avoid panic. We should avoid fear. And also we should avoid fake news. Let us strive to get informed through credible sources. If you want much information on COVID-19 and you are literate, you had rather go to the WHO website where there is a situation analysis almost on a daily basis and updates are given.
Okay.
Then we could also get credible sources which are valid from government, the Ministry of Health, and so on and so forth.
All
That
right.
would be a good way of trying to escape the
Okay.
fear and the panic. Yes.
Many thanks. Maybe last word as we
Yes,
finalize.
COVID-19 is with us.
Yes.
It is not a death sentence. Let us just keep to the basics of prevention, and the sky is the beginning.
The sky is the beginning.
There's no limit.
All right. Thank you very much, Professor. That is Professor Lois Orago, together with the Dr. James Ogutu, who is a microbiologist, discussing the very pertinent matter, very important issue. Remember not to panic and, of course, observe the basic requirements. We're taking a very short break.